Hello, I'm Dr. John Abebe, the Medical Director of Georgia Abebe Fertility Center and the lead tutor at the Georgia Fertility Academy. Welcome to our advanced fertility training program for doctors who are starting off their career in the field of human reproduction. In this module, we'll be looking at fertility preservation. And this module has 4 units. We're looking at the indications for fertility preservation, techniques and procedures, the ethical and legal considerations, and lastly, counseling and patient education. Under the indications for fertility preservation, we shall take a look at cancer patients, individuals undergoing gonadotoxic treatment, and we'll also look at non-medical indications as, for example, elective oocyte freezing. And we'll also look at the techniques and procedures for oocyte retrieval and cryopreservation, for sperm banking and storage, embryo freezing and storage, and ovarian tissue cryopreservation. The third unit, we're looking at the ethical and legal consideration, the consent and ownership of preserved gametes and embryos, and the future use and disposition policy. And lastly, under counseling and patient education, we shall take a look at informing patients about options, success rate, and risk, and then talk about coordinating with oncology and other specialties for integrated care. Now, what are the learning objectives of this module? This module explores fertility preservation methods and procedures which are critical for patients who wish to protect their fertility before undergoing treatment or procedures that may impair reproductive health. It covers indications for fertility preservation, the techniques involved, the ethical and legal considerations, and effective counseling and patient education strategies to support individuals in making informed decisions. It is therefore our hope that after going through this module, every student will have achieved the following learning objectives. Number 1, as concerning indications for fertility preservation, the student should have learned about the medical and non-medical reasons for fertility preservation, including cancer treatments and elective options. And 2, under techniques and procedures, the student will have understood the different procedures used in fertility preservation, such as oocyte retrieval, sperm banking, embryo freezing, and ovarian tissue preservation. And lastly, under ethical and legal considerations, it is our hope that the student will have explored the ethical and legal issues surrounding the consent, ownership, and disposition of preserved gametes and embryos. And lastly, under counseling and patient education, that the student would have gained skills in educating and counseling patients about fertility preservation options, success rates, risk, and coordinating care with oncology and other specialties. All right, so these are the learning objectives, and I want to wish every student a great time going through this module, and I look forward to seeing you in the next module, which is module 7. Have a nice day.